Good afternoon, and thank you so much, Harry, for that very kind introduction. You know, the work and commitment of Bill and Melinda Gates and the Gates Foundation that they have undertaken across a range of humanitarian initiatives have had an extraordinary impact on eradicating diseases and improving health outcomes for people the world over. And I offer my thanks once again, as I have thanked them in the past, to Bill and Melinda both for this lifelong passion and commitment, much of which I have seen up close and personal, and I certainly am thankful for what they have done to help so many. I also want to recognize USAID Administrator Mark Green. Under Mark's leadership, USAID will continue to be a leader in global health and development issues, and I hope that individuals and organizations in this room who share Mark Green's passion for helping people will continue to partner with USAID. As those of you who have dedicated yourselves professionally to global health and other fields of international development know, the challenges we have all committed to solve require a clear vision, a plan of action, dedicated individuals, and a constancy of purpose to complete the mission. While victory is not tomorrow, probably not next month or next year, or maybe not even the year after that, we all arise every day with the belief that one day is coming. Long-term solutions to daunting global challenges demand patience and perseverance. In our society, of course, we often want results immediately, and when we witness the human cost, having that sense of urgency is okay. It is hard for human beings to exercise patience in the first place, but it is important, I think, to measure our success and celebrate progress, even if it is incremental. An incremental approach may not be as satisfying or generate as big a headline or publicity, but if we're truly mission-driven, then we need to keep putting one foot in front of the other and without wavering from our goal, every day get up and take another step. I know that the patience and dedication in this room will pay off. The President's Emergency Plan for AIDS Relief, better known as PEPFAR, of course, is one of the sterling examples of what I'm talking about. When PEPFAR began, the prevalence of AIDS in Africa seemed an insurmountable problem. At the time, only 50,000 people in sub-Saharan Africa were receiving HIV treatment. In many countries, an HIV diagnosis was a death sentence. In the hardest hit regions of Africa, infant mortality had doubled, child mortality had tripled, and life expectancy had dropped by 20 years. More than 14 million children had lost one or both of their parents to AIDS. Now, 14 years after PEPFAR's creation, we have not only saved millions of lives, but we're getting ever closer to ending this pandemic by supporting HIV treatment and prevention services using data and analytics to improve performance, find efficiencies, and increase the impact.